Hi, I'm Dr. Casey Wilcox, and I'm the 2023 FDC Program Chair. And I'm here with Dr. Brooke today, Dr. Brooke Fukuoka, and we're going to learn a little bit about her courses and what she's going to have to offer for FDC this year. We're so excited to have you. Thanks for being on with us. And I will just jump off and let you tell us a little bit about yourself and your background.
Awesome. Well, thank you guys for having me. And I am really excited to come down to Florida for multiple reasons. One is your weather, and also the opportunity to see a little bit more with Disneyland. My husband's going to come with me, so I'm excited about that. And it'll be kind of like a vacation hyphen conference. So,
Absolutely.
yeah, so I'm a general dentist, and I isolate my practice to treating patients who have special needs, geriatric patients. Basically, we're a referral-based practice, and so we see a myriad of patients, but it's focused on patients that may have a difficult time in another general practice. And so it's a really unique situation. I really like it. I have lots of jobs. And so one of my jobs is we call it the Advanced Delivery Dental Clinic for our local federally qualified health center. And that's an awesome job. We get to see patients all day long that have special needs. We get to do all sorts of different unique programs that I look forward to talking to you guys about, how to start those things, how to do those things, different things that we do in our office, but also things that you could do in a regular general practice that can help expand accessibility for these patients. And so that's a fun job. I also have a portable clinic that goes into long-term care facilities where I work really closely with my hygienists. And we'll talk about that in some of our courses as well, how you use telehealth, how you work with different facilities, just kind of unique modalities of care. I have a hospital practice as well. Those two are together. The portable one that goes into long-term care facilities and the hospital practice. Those are one practice. It's called Your Special Smiles. That's my private practice. And I love that practice. It's so much fun. We just do all sorts of different things that we weren't able to do in the health center. And so I practice dentistry in a unique way. We do some unique procedures. We have unique tools, and I just really enjoy doing it. And I look forward to sharing with you guys some of our stuff.
Well, you're definitely very busy. Sounds like you stay hopping around. What got you interested in special care dentistry?
I just enjoy treating patients who have special needs. They're fun to be around. I like to hang out with them. I like to spend time with them. I like to get to know them. They're fun patients. And so when I would see somebody who had special needs on my schedule, I would get excited because that person was coming in. And those were just the people that I wanted to keep seeing. When I was in dental school, I did an externship with the Lee Specialty Clinic down in Louisville, Kentucky. And it was this excellent experience. It was all adults and all patients who had developmental disabilities. And it was so much fun. And I thought, this is what I want to do. And it's funny because everyone thinks I'm pediatrics, but I don't see
Yeah.
anyone under 14. I mean, I think I have like one 12-year-old patient because the pediatric dentist asked me to. And so people always think, oh, special needs, those are kids. And it's not. There's this whole other world out there that are adults. And that's what I do is I focus on the adults.
Awesome. And there's such a variety of special needs, especially when you get into geriatrics. And I know with my practice that I have several geriatric patients, and they bring you a whole other realm of, concerns and problems. And I'm just looking forward to hearing some of your techniques and things like that on how to treat these patients. And what would you say are some of the most popular or useful techniques for these patients, special care patients?
Well, special care in general, yeah, and I totally agree with you with the geriatrics. I was in special care and I started getting all of these referrals for geriatrics, and that's how I got into geriatrics, was because I live in a small town. And so all of a sudden it's like, oh, she does hospital. She sees patients who have special needs. I'm going to send all my dementia patients to her, which is great. And I enjoy seeing dementia patients, but I wasn't as educated in geriatrics. And so I've had to educate myself in geriatrics and find mentors in geriatrics and take continuing education in geriatrics to kind of bone up on that a bit, to learn more with geriatrics. But there are a lot of similarities in these populations. And silver diamine fluoride, which we do have a course coming up on, we do a ton with silver diamine fluoride and other topical medicaments. I mean, that's not the only one. It's the one we use the most frequently and probably have the most evidence for, but we have other topical medicaments that we'll be talking about. Visualization. One of the hardest things that we do in special care dentistry is being able to see what we're doing and have the patient hold still. So just different techniques of like using things like a bite stick. Like this is a bite stick they can take at home, and just having them be able to bite on one side so they stay open. Sorry, I hit the microphone there. It probably made a terrible noise on your end, and I apologize. Didn't hear it over here, though. It's a great thing about microphones. But then we have these, the soft tissue retractors that are silicone based instead of a mirror, and just the size of it, being able to just,
Mhm.
get in there and look at some of the different equipment available for these things. Look at different techniques of how do we get in the mouth when maybe the patient is moving all over the place. Intraoral cameras, those are awesome because I can't push pause on my patients, but I can push pause on the camera. And so I love those. So I would say those would be the biggest things. And of course, just liking them. Like
Yes.
any patients can tell if you like them or don't like them. And if this is a population you like to treat, they can tell, even if they're nonverbal and
Mm,
you don't think that they're understanding, they do understand if you care and that you like them and that you want to be with them. And so I think that's the
yes.
biggest thing, is liking them.
Yes, and I think that makes treatment go so much smoother. It's a lot less stressful for everyone. They can feel your stress, and I think that makes a big difference too.
Yes.
So, what's something important to keep in mind when treating these patients? I guess along with patients, uh, I guess having to slow down a little bit and take your time and that kind of thing. Like, what else would you say are some important things to keep in mind?
I think being okay with failure is really important. Like
Yeah.
you might have set out that this is what we're going to do today, and that is not at all what you do that day. Some of our appointments end with, well, this isn't going to work, but we can't end. One of the biggest problems we have is when someone has, we call them a behavior, when someone has a behavior and they drop to the ground and they're screaming and they're yelling and they're saying the F word, and you're like, what am I going to do? And the first solution is, get them out of there. Well, that's a learned behavior, right? You can do those kind of things and get them out of there, get them out of there. That's not what we like to do. We like to say,
Mhm.
okay, maybe put them in another room right now so they're not disturbing other patients, give them a break to calm down, allow them to deal with their emotions in a positive way, and
Yeah.
then revisit that. You're not going home. Now, we don't want to force them to do anything while they're doing that. That's not going to benefit anybody, but we let them have their behavior. We let them get better emotionally, and then we end with like a high five, low five, high five. How you doing? Thumbs up. Can you do this? Can you do that? Can you turn on the light? Can you turn off the light? And we give them tasks so they can easily complete, so that we make sure that we end every visit on a positive note, as well as them doing something that we ask them to do. Because
Yeah.
when we end on that high stressful situation, when you come back, you kind of pick up where you left off, or
Exactly.
they've learned that, like, hey, if I yell the F word, then I get to go home. And we don't want that to become a regular behavior. So that's one of the big keys, is just being okay with that, with your success being a high five, but ending on
Right.
success no matter what.
Exactly. Yeah. So what are your biggest takeaways as a dental team that you would like for your courses at FDC, and tell our attendees why they should attend your course?
Well, I think our courses are geared to the entire team. And so we do encourage everyone to come in. If you're a receptionist, come to the course, because we talk about everybody on the team, especially our wonderful world of special care. That is going to be more of a hands-on simulation style course. And that course is really for the whole team. It's just geared for you guys to know what it feels like to be in the dental office and be one of our patients. So we have various simulations, and you'll probably feel a little awkward at times, and that's intentional. And it's supposed to be an emotional experience. It's supposed to be an experience where you come in and you leave having felt things, not just learned things. And so that's my personal favorite of all the courses that we do, because I get to mess with you guys a little bit, and it's really fun. Like I'll pick on you, but not in a mean way. You won't get hurt or anything. But
Yeah.
it's a ton of fun, and I think that's the best one for the team, because then you'll really understand from various different perspectives how every individual on the team can make a big difference in making that office more accessible and more welcoming. There's a difference, right? Accessible and welcoming are two very different things. If your
Yes.
office is accessible, that means they can come in the door, but if they're welcoming, that means they want to. And that's our goal, is we want them to want to come in, not just be able to.
Yep. Absolutely. And it takes a team. It takes everyone to make that experience. And that's what we're about with FDC, and we're about the team. And so we're so excited to have you. And we look forward to you joining us in Orlando in June, and hearing all of your wonderful courses. So thank you so much.
Well, thank you so much. I look forward to seeing you guys. Maybe I'll get Mickey ears.
Yeah.